as you know, this is Daniel Stein. So welcome to the Let's Get Technical call. Just want to let you know that we record these calls so that folks who can't join or who want to go back and listen to some of the detailed conversation are able to do it. Those are posted pretty much within the first within a day or so of the call, along with some notes as well there, so you can find all of the details and past events on the NIC Hub, which you should be familiar with at this point in time. So welcome everybody today to the Let's Get Technical group. Today we're going to be talking about information management in justice and public safety. And if I can advance there we go. So here's the agenda that we're going to be talking about today. I'm going to do a little bit of welcome, like we always do. New people on the call or people who are returning or just want to say something wonderful new that's happening in their work life. We'll open it up for folks to do that. And then we'll pretty rapidly go right into the domain discussion with Paul Wormley, who is so graciously agreed to share some of his knowledge, wisdom, and experience from a few decades of doing this work around interoperability from the information management, from the justice and public safety world. And then toward the end of the call here, we'll do an update on the proof of concept and person matching work group that has been starting to take shape over the last couple of weeks here, and that's pretty exciting. And Dave Walsh and others, Pradeep and Rita, who may be on the call today, will provide an update. And for those of you who are particularly interested in that, we'll be talking about where that's headed, how you can participate and sign up. And then also you may have seen from some of our mailings, there are some upcoming events and activities that are being scheduled the next 2 weeks in particular. But also we are working to have really a calendar of events through the remainder of the year and into early next year, so you can start to plan more some of the particular presentations and the discussions that we'll be having. So we're giving you advance warning on that, which is great. So if what we'd like to do is in your, you can go to the chat box on the menu, and the way we want to sort of handle this is if you're new to the call, just go ahead and just write your name, and I'll call on you. And what I would do is ask you to introduce yourself and a little bit about where you work and what you're interested in, and just to introduce yourself to the group as well. So that's for new people who are on, as well as anybody else who feels like they want to make an introduction. So go ahead and just type your name in, and I'll call you. I think we figured out that's kind of the best way to go with this. All right, there we go. We're starting up there. So Lisa Davis, welcome to the Let's Get Technical. How are you?
Hi, good morning.
Hey,
hi,
great.
So I'm Lisa Davis, and I am General Counsel for Signify Community, which is a tech-enabled sharing platform for social determinants of health and connecting community-based organizations together to support community needs. And I'm particularly interested in today's topic as it relates to law enforcement access to robust record sets.
Terrific, welcome. Remind me again, what's the name of the organization?
Signify Community.
Signify Community, great, cool. Welcome, and then Stephanie, welcome.
Hi, this is Stephanie.
Hi.
I'm also here with Karen Moline on the line. We're from the International Association of Chiefs of Police. And we have a project that we're working on to create a resource page for law enforcement response to opioid overdoses. And Karen can tell you a little bit about some of the other projects she works on as well.
Hi, it's Karen Moline. Hello, and I also work on pre-arrest diversion, and I work on the MacArthur Safety and Justice Challenge project, and with PTAC, the Police Treatment and Community Collaborative, which is all about pre-arrest diversion, advocating and educating on pre-arrest diversion. So those are some of the projects that I work on as well.
Welcome. Great. We'll look for your participation, questions, and thoughts about this. All this stuff relates. And for those you're familiar, I know we've talked about this. We do have another group on opioids that's on the hub as well. So there's lots of information and people who are interested in that topic as well there. So welcome to the call. And Paul Nelson. Hey, Paul. Are you there? Sometimes we have audio issues. Are you unmuted? There you go. Oh, you're muted there. Let me unmute you, or hopefully that'll work. I'm having trouble unmuting you. Okay, I don't know why it's not unmuting Paul, but it looks like it's unmuting there, or it's not unmuting. There you go.
Okay.
Hi.
I'm sort of a distant observer of the justice involvement in health communities. My main interest is kind of a hangover from my now retired career as a primary physician for 40 years. And I've always tried to work towards some sort of unified, shall we use the word, epistemology for health and its various dimensions. So here I am to observe.
Oh, great. Welcome. And good luck on your recovery from the healthcare career.
Well, I appreciate the sentiment. You know, it was a pretty amazing privilege to have done that.
Yeah, I imagine looking at where we're headed now, it's a daunting, good to be on the other side of that, perhaps.
Well, yes and no. Anyway, it's a continuing interest, and I've made some headway with trying to make some definitions, but that's another story.
Okay. Well, welcome to the group.
Thank you.
And Jessica Peter.
Hi, good morning. My name is Jessica Peter. I am with 211 San Diego, so we are very familiar with NIC, but I am new to this webinar series or system. So I just wanted to introduce myself. I'm the Director of Business Development at 211 in San Diego, and I'm working with our programs team on some different projects that would integrate public safety in some way within our Community Information Exchange, the CIE. And so I just wanted to start engaging in the discussions to see what's coming down the line for us.
Fantastic. That's great. Welcome.
Thanks.
And that's great. Yeah, we have a long-standing relationship with 211 in San Diego, so I'm glad you guys are coming to the table here as well. There's Tim Diamidi. If I got that right?
Yeah, pretty close there. Tim Diamidi here from Public Consulting Group. I am a contractor for the state of Maine. I serve as their substance use and health epidemiologist. And actually, PCG does have another project in San Diego where we're trying to integrate criminal justice data and behavioral health data with the county of San Diego. So looks like you guys might be good resources for that as well.
Yeah, it sounds like I got all the right people on the phone here, which is terrific. Anybody else who is new to the group or wants to say hello? Anything new going on? Yes.
Daniel, hi, it's Tony Capizzi, Judge Capizzi.
Hey, Judge.
I've been able to join for a while, but I'm in on the call, and of course, you know, I do a lot of work in this area, so I'm looking forward to the presentation.
Yes, welcome, Tony. Glad you can join us for a bit. I know that this is an area of interest to you and the judicial system altogether.
Yes.
Anyone else? Okay.
Daniel, I'm going to take, this is Adam Pertman. I work with Daniel and Dave on this group and many other projects. Just for those of you who have not been on before, there will be a presentation, but it's a very much an engaged conversation. So please feel free as the meeting goes on to jump right in.
Thanks, Adam. Yeah, we'll encourage that throughout here. So with that, we'll move along here. As Adam said, you know, webinar kind of forums like this are typically one way that's hard to engage conversation, but we try hard to do that. We ask you to either send a note on the chat or raise your hand, or just break into the conversation as appropriate, so to get your voice out there. No need to apologize for that, but you know, bringing your voice to the conversation is really wonderful, and we look forward to it. So don't be shy or bashful in that regard. Okay, so what I want to do is just give two minutes here on this graphic for folks who have been involved and new folks to the call. One of the things we're trying to really do within the National Interoperability Collaborative, which is a Kresge Foundation funded initiative we've been involved with for a couple of years, is to focus on not only the individual domains, as we refer to them, whether or not they're human services or education or public health or public safety, health information and technology, and emergency medical services. Each of them is in their own right a whole universe of activity and relationships and networks and all those kinds of things. We're interested in that, and we're also interested in the cross-domain work. So how do these different domains actually intersect and share information, and or are unable to share information for a whole variety of reasons that many of us are familiar with, and how do we address some of those barriers and some of those challenges? And that's really the work that we've been focused on, and we're highly interested in that. And what we're doing at the NIC is trying to bring in subject matter experts who are interested and involved and knowledgeable at any or all of the above. And we're working towards these cross-domain kind of conversations that are vital to success, vital to making progress on whole person care, and really addressing the needs of individuals, families, communities. And what we have found over the years is that there's a lot of similarities in the challenges that each of these domains is facing, but that there hasn't been necessarily a communal watering hole, so to speak, where folks can come together to engage in this work. And fundamentally, that is really the goal of the NIC. And as we go forward over hopefully the next months and years, we will better define subject matter experts and more formally have those kinds of conversations and structure those conversations around and across those domains. So we'll also be looking for people and inviting people to come in and to be domain stewards and to, in a way, curate those domains so as to be able to bring sort of the latest thinking and knowledge to the table and be able to engage in those cross-dimensional and cross-domain kinds of conversations, which are very exciting and in short supply generally. And we can talk more about that. There's, I've mentioned in the past, we wrote a paper about this for the Health Information Management Systems Society, or HIMSS, which articulates those things, and is a good roadmap as we look at developing standards or methods or processes or applications. If we do it in one domain, how applicable is it in another? And that's one of the questions we're really looking at. And so one of the domains that we're particularly interested in, that oftentimes in the health and the human services space is not focused on, is the area of public safety and law enforcement, as much as and as important as it is in terms of the impact on many people who are involved with service delivery, and certainly issues opioid and substance use disorder and all sorts of other areas. So as we've been preparing and scheduling different topics for discussion, we felt it was an appropriate time to make sure that we're bringing public safety and law enforcement into the conversation. And I don't think there's anybody better equipped and prepared to talk about that than our own Paul Wormley, who has a long and distinguished career in both in law enforcement and public safety and many other domains. Worked at the federal level, worked at the state, local level, and has really been a strong proponent, an advocate, and a voice for information sharing and interoperability and standards. For anyone who knows Paul, you'll know that that's something that he is totally committed to his career. And as a board member of Stewards of Change, it's been a real delight and pleasure to have Paul be able to share that knowledge and experience and relationships and networks with us as we do this work. And so today we've asked Paul to share a distillation of some of that knowledge that he has accumulated over the years, and how we can apply it, and how we can use it, and how we can learn from that as we go through our work, and as we look at creating solutions and proofs of concepts and actual learning environments, learning communities to be able to do that. And so I've had the privilege of knowing and working with Paul for a bunch of years within the Stewards of Change environment and our symposia. And so I want to welcome Paul to the table and turn over the mic to you and help us kind of walk through this complicated and large field of knowledge that we so desperately need to know more about.
Well, thank you, Daniel, and I appreciate the kind words and the nice introduction. I do have a few years under my belt in this field, and I've learned a fair amount. I've also made as many mistakes as anybody else, so that's just a way to share those lessons learned, hopefully, a little bit. It's very difficult to cover what the scope of this field is in a short call, but we'll try to buzz through it. And I really want to echo Daniel's point that this is a dialogue, not a lecture. And anytime anybody wants to pop in and add to what I'm saying or contradict me, take issue with it, I appreciate the IACP staff being on board because they can certainly contribute to this discussion. And I'm also very delighted that Judge Capizzi could join us because we're really talking about some of the issues that have occupied his career as a juvenile court judge in Dayton, Ohio, and his contribution to this field has been very significant as well. So I'm delighted to move forward with this effort.
Thank you, Paul.
And I'm hoping that I can change the slides, Daniel.
I'll drive at least the first one here.
Okay. So the first point I'm going to make to you is that we use the term public safety in describing that domain component of NIC, but it's really shorthand for justice and public safety. We really have to take into account the full range of activities that the criminal justice system gets involved with, because public safety is too often referred to as just the collection of first responders that respond to events of serious nature. But as you can see, and if I had the ability to show you, actually I do, the public safety world is really generally referred to as the law enforcement, fire services, and emergency medical services that respond to events and deal with patients and crimes. But the law enforcement part of public safety is also an integral part of the criminal justice system. We defined this as a system some years ago. It's really not, but it works for a lot of people. So the law enforcement agencies are kind of the cornerstone both of the public safety world and the criminal justice world. The data that's used in dealing with the administration of justice comes from the criminal justice agencies, but all of these components are involved in the administration of justice as well as what you think of as the normal law enforcement functions. It's also notable that all of these agencies operate at every level of government, from local to state to territorial to federal. So these agencies are all connected in ways that we'd like to see this. And I'm having trouble changing slides. There we go.
But just let me say change slide or advance, and I'll go ahead and do that, Paul. For some reason, the Zoom doesn't always respond appropriately.
All right, so next slide. So if you look at all the government agencies that are involved in public safety and administration of justice across.
Our competitor to Tamiflu, generic postal Tamiflu, is really picking up speed these days.
Okay.
Zofluza, XO.
Paul, I'm gonna mute everybody and then unmute you.
One pill, one time, versus 5 days times 2.
Okay, let me unmute you now. Hang on one second. Where is Paul? There you are, Paul. Sorry, which phone number? Paul, which phone number are you that I can unmute?
I think you just unmuted me.
Okay, great. Okay, go ahead.
So, you know, you look at the variety of agencies that are engaged in public safety and administration of justice. The people who are in red on this chart, assuming you can see those colors, tend to be elected officials, but many other leaders are appointed officials. But these functions of criminal justice and public safety exist at all these levels. Next slide. And they're all connected in various ways in the public safety and justice field. There's a whole lot of national organizations that influence what happens in the field. Listed on this slide, this is only a sampling. There's probably 50 different organizations that are membership-based in most cases, to engage the practitioners across this entire field to help with these problems. The next slide. But there are a series of important national information sharing capabilities that have been built over the years in public safety and justice, as most notably the FBI's work in building the National Crime Information Center, which was started in the 1960s. And then over the years, the FBI has built the capability to have a centralized file of fingerprints and identification, which is now morphed into a full biometric capability in the next generation of IAFIS. The Interstate Identification Index keeps an index at the FBI called criminal history records for all the states, but the detailed records of criminal history are stored at the state level. And then there's a parallel network of what used to be called the National Law Enforcement Telecommunication System. It's really now the National Network of Information Sharing and Law Enforcement that really ties together all of the agencies throughout the country. And of course, we have a more recent invention of the Homeland Security Information Network, which connects particularly those people involved in Homeland Security activities, emergency medical, fire, and public safety first responders. Next slide. And we've really built a national capability with a number of integration layers. If you look at what happens at the local level, local law enforcement and fire and EMS agencies keep computer-aided dispatching systems, records management systems. The prosecutor courts and jails have case management and records management systems as well. And they connect at the local level, but they also, for most of these agencies, have a connection to a state level, including things like a criminal history repository and warrant information that's available at the state level. And they're linked to the FBI system, the NCIC, III, IAFIS, and now most recently the national identification capabilities that have built. The FBI has been building in this criminal justice information system, a system of systems that ties together all these various repositories at the federal level. Next slide. So having moved forward with this, we haven't made a lot of progress, but if you look at the sources of data available from the whole law enforcement and justice world, public safety and justice world, you have all these information systems at the local level, sometimes a municipal CJIS system, the prosecutors, courts, corrections, at city and county levels. And then at the state level, there have been built some state level integrated justice information systems, mostly around criminal history information. There are county and regional systems in between the locals and the states, but the states are the kind of the gateway to the federal level. All of the states are connected to the FBI's computerized criminal history system and the National Crime Information Center. And all the data on crimes and arrests that have been recorded over the last 85 years are submitted by local police agencies to state agencies, and from there to the FBI's National Uniform Crime Reporting System, which is now being replaced by an incident-based system. Next slide. So that's kind of where all the data lays and how it comes together and flows from local to city, or city to county to region to state to federal.
So Paul,
just to give you,
I was going to say, as you're kind of going through those various layers, I'm interested and curious about the kind of conversations, and I know that's probably several days of a seminar, but in terms of the approach to sharing information between the various levels of government and across the various domains or agencies within government, has that been, obviously it's been an evolving process over time, but I'm hoping that as we move into this conversation further, that you'll be able to, sort of bring some of those lessons learned to this space. And I'm wondering if there's anything that sort of pops out at you that you've seen around sort of constructing this, because this looks very much like a local, county, state, federal picture that you could see within the health and human services space as well.
Yeah, I'm not sure there is anything in a parallel in health and human services quite like there is in public safety and justice. The key to all this has been the building of networks. Even before there was an internet, the FBI had created, plain old telephone lines, dedicated telephone lines between every state and the FBI, and then each state built a network within the state to keep that capability to send data back and forth. So the network creation was started probably in the 60s, actually, is when it got started, and it was pretty well established by the 70s. So there was a platform to do this. But what then really drove it was, in many cases, I'll talk more about this, but the FBI created what we would think of today as de facto standards for data elements and for how data, not just reporting data, but exchanging data, creating national repositories that were based on standardized data element definitions and terms, which even though they never came out and said you must do it this way, they really created a set of data standards that have been largely adopted on a voluntary basis by state and local agencies. So the local police department uses the same kind of data standards in every case, for example, for values of things like ethnicity and gender and hair color and eye color and those kinds of standards. The FBI just created that initial set and has kept it up over the years. So everybody looks to the FBI and say, well, what are the different values of eye color that we care about? What are the different values of how do we, report ethnicity? Those kinds of de facto standards have really driven this, so that you can send data on arrest record from a police department to the state, and the state knows exactly what the data means because everybody's using the same standards for most of that data. The National Crime Information System started that, and then the course, the Uniform Crime Reporting Program and now the National Incident-Based Reporting System, all of this based on those proposed standards that are developed. And quite a number of, what happens is that people go out and buy a new case management system, and they just put in the specification, you'll follow the FBI standards, and that's what creates the opportunity for interoperability up and down the line.
Well, I think that's one of the things that's been really exciting in our interactions with you and other folks in the field is learning from that kind of standardization and creating the standards that could really facilitate the cross-domain sharing. So I'm glad you mentioned that, and I'm sure we'll talk a little bit more about that as we go forward. But that seems to be one of the major lessons learned is that sort of that approach to standards as we look at cross-domain kind of sharing.
Yeah, and I'll talk more about it in a minute. Just to give you a quick idea of what the kind of depth of data that's available in a local police enterprise information system, most the term that's used in law enforcement is records management system. This is a common set of components, and you can see all the diverse information. Many of records management systems have 15 to 18 different modules, from case management to booking to custody management to asset management, wants and warrants, et cetera. But they generally are all built around a centralized database that has indexes to incident, to master location, master property, master name index. And a lot of the work that's been done in this field about master indexes is, I think, very translatable to health and human services and education, for that matter. A lot of the early work in the building a master name index came out of the justice and public safety world before it was even popular in the health and human services world. There's a lot of experience and lessons learned there, a lot of research that's valuable in it. Next slide. So, and it would go beyond the police world, and every other component of criminal justice has generally they're called case management systems. Prosecutor will have a system that has charges and lets people file briefs and record hearings and so on. Courts receive those filings and do the adjudication of cases, and so there's data on sentencing and the disposition of those charges. The correctional agencies have information systems that supervise the institutional inmates at the federal state levels, and even community supervision, and have medical records. There's a whole lot of interesting interactions between the corrections world and health and human services, and dealing with the inmates that have mental health issues or have drug problems as they're incarcerated and as they're released into the community. Enormous amount of interchange that is needed, and it happens in a pretty haphazard way at this point. Next slide. So, oops, going the wrong way.
Went the wrong way. There you go.
So what all these agencies in the criminal justice world have been trying to do for a long time is to try to figure out how to exchange data with each other, to eliminate the duplication of data, to increase the efficiency of dealing with people. The common element across all of these agencies is the offender. So as the person is arrested, and then the prosecutor files a case, and then it gets turned over to the court to adjudicate that case, and corrections, applies a sentence. They're looking to find ways to make that information sharing, to reuse data as it flows through the system, so we get a much more effective and higher quality administration of justice. Next slide. And the design of all these systems for years has been driven by a number of design objectives that are pretty widely recognized in this field as a whole. we really want to minimize redundant data entry. There's an enormous amount of duplicate data entry, and this is a lesson that public safety and justice agencies saw years and years ago. And I think the Health and Human Services world has the same problem of having data about the names of patients they've re-entered over and over again. I'm really kind of tired myself of going to every doctor I ever end up going to wants me to re-enter my medical history over and over again. And you know, in the criminal justice world, they're really interested in getting fast interagency data transfer, because as someone is arrested and brought to attention of the prosecutor and to the courts, they need the data about that individual and the behavior that's in question. And, you know, it has to be there immediately and not months or years later. There's a very strong concern for event notification capability, because the processing of events is kind of the bread and butter of this whole system. People are concerned about maximizing the integrity of data, so there's strong rules for auditing and making sure that the data is indeed accurate, and really to get away from relying on paper transfers. I see this over and over again in the healthcare field that's having the exact same objective. Next slide.
So Paul, as you're looking at this, these are all important design objectives, and you'll talk about the constraints. It'd be interesting, if not here, then at some point here, you organize all of these various levels who are participating and contributing and using and sharing and posting information, adopt these design approaches. Is it fragmented? Is it coordinated? Is it top down, bottom up? How is it actually structured to go across all of the different participants here?
Well, I think most of it comes from it's a variety of sources. It comes from you know, RFPs that are issued based on agencies sharing with each other what their needs are. It comes from grant conditions that are imposed by the federal government. Department of Justice, Department of Homeland Security, and others provide grants to a lot of agencies to buy systems, and you know, through issuing standards or advice and counsel about best practices, there's a lot of work that's been done to say how you ought to build systems. There are functional specifications that have been built for police systems, court systems, correctional systems that are used as at least guidelines, if not standards, for what functionality should be achieved in building an information sharing capacity. I'll talk more about that a little bit later, but it's kind of learning the best practices from the field that have been established over the years. Right. Companies do this by proposing a system design and having customers react to it. A lot of this stuff is done with off-the-shelf products. 80% of all the computer systems in law enforcement are products that have been built by companies that provide these products that keep the cost low, relatively low. So those products have been tested against the needs of hundreds of agencies in some cases. But there are design constraints, as this slide shows, that are very important and have been important for years. Every agency thinks it's different, which is only partially true, but they definitely are autonomous and have the control over what their system's going to do. There's been for 50 years, there's been a focus on privacy and security and law enforcement and justice systems. We started when I was running a group called Search back in the 70s. We wrote the first law on privacy and handling criminal justice information in 1972. That became law. And a lot of work has gone on. Tony Capizzi, who's on the call, is involved with the running a very important privacy committee just a couple of years ago for the Global Information Sharing Advisory Committee to the Attorney General. So it's been an ongoing work from the Global Information Committee and from Search and others, and IACP has been involved in this work as well. So the whole constraint is that you got to be able to exchange information on locally defined rules. There's not, you know, this is a voluntary whole network and system. It's not, the federal government can't tell the local governments what to do, and this is very much recognized in this field. And there's all kinds of work that's been done on access and dissemination controls, which are relevant, I think, to other disciplines as well. Next slide.
Paul, I don't know if you see your comments, but there's a couple of questions coming in here.
I'm not seeing them, so ask them.
Okay, so Greg just put one up. I can read it, or Greg, you can articulate that as well yourself, if you'd like.
Sure. Hi, Paul. Good to hear from you again.
Hi,
my
Greg.
question is about design principles and relatedly design objectives that anticipate instances in which interoperability might be undesirable and potentially harmful. And my question is whether there are established principles that can guide designers and stakeholders through the process of delineating use interoperability as clearly and satisfyingly a good thing versus use cases in which interoperability may actually have unanticipated harmful outcomes.
Well, I don't think anybody really thinks of interoperability in a vacuum from what purpose is to be served by interoperability. I don't, you know, we all have some general notion, I suppose, that interoperability is a good thing, but it really only becomes a reality when you think about what is it for? If you're dealing with a particular a processing of offenders through the criminal justice system, the purpose of interoperability is to be able to share that data in a way that eliminates duplicate data entry and makes things more efficient, but at the same time protects the privacy of everyone concerned. So it's a combination of the constraints on the objectives that sort of make you focused on having interoperability that's not necessarily damaging. There are, I'll be the first to tell you that there are people who don't believe in interoperability. I've been in meetings with defense attorneys who say, oh, we don't want any information sharing to happen.
I believe that was the legal principle for a long time in the United States government, that agents were prohibited from sharing information about people.
Yeah, you're exactly right. I was in a meeting just a few years ago with some federal attorneys who said, you know, well, we can't share any data with state and local government, so the Privacy Act prohibits that. Well, you know, that's not true, and it's not necessarily the right answer. It's only a concern where you can identify things that are doing damage, and there are such things, but you have to control what the purpose is for the interoperability and limit and constrain what the interoperability is so that it achieves that purpose and no other. It's a good point. So this is just a quick slide of the justice community of interest, and just to make the point that there are lots of components to the justice system. In any given county or regional area, you can find it. You know, people think when we talk about courts, there's only one court. Well, that isn't true. Tony will tell you that, you know, in his county in Ohio, he's probably got a dozen different courts that meet and act and adjudicate cases. Juvenile courts, adult courts, family courts, drug courts are all active and supported. And then you have in a county, you may have if you're in LA County, you're going to have 89 different police departments in that county, and multiple different jails potentially. So there's a collection of agencies that are working together in a community of interest, is the best way to call it. As I said earlier, we try to define this as a system, but it really is not a system in any engineering sense. It's a collection of agencies who a common focal point on reducing crime and adjudicating offenses. But they're all tied, they all want to be tied together to share data. Next slide. And what really happens is data gets moved from police to the prosecutor to courts to corrections, and this data about the offender, the cases, the arrests, the booking information, the demographic data, and along the way, as the pretrial work is done, the police collect data on a lot of the medical data and other data that's pertinent to the individual, that's of interest for human services and health and educational purposes as well. So there are lots of links to the rest of the world. Next slide. Security has always been a big issue in building these systems. Unfortunately, the lessons of the past are that we control access by personal ID and password, which is woefully inadequate. There's been a lot of work done on digital certificates and extensive work on different firewalls and encryption. If you listen to the FBI, their general advice is encryption is the best answer to anything to keep the data secure. We're really talking, there's been a lot of work done on safeguarding data to keep it secure and making the right kinds of backups and all those kinds of things that have to do with keeping the data available and secure. Next slide.
As we think about some of the connections between what and how public safety is doing this work, having to protect information, but also having to share information at the same time, that balance between the control versus the access and usage of it, I'm wondering if there's things that come to mind that again would be, things that we should be considering as we think about, again, cutting across various domains and programs that would be useful to think about.
Yeah, I think one of the things that we've come to understand in the justice public safety world is that security has to be inevitably role-based, and most systems have now matured to the point where they define a set of roles and then define security in accordance with that. I don't see that as much in common across the health field, but it is certainly there's one thing that's missing in law enforcement, and that's consent management. Police don't need the consent of an offender to start putting their demographic data in the database or using it for criminal justice purposes. As long as it's used for criminal justice purposes, and every system that's built has a warning light on it, so to speak, that it can only be used for criminal justice purposes. But when it's that way, there isn't a big issue of consent like there is in healthcare and human services systems. But role-based security is a kind of fundamental thing. And privacy is really important to the criminal justice field. There's been a lot of mistakes made in criminal justice and law enforcement building systems that didn't protect privacy, and those systems have been, shut down by governments because they didn't take this into account. But the basic policies for privacy have been built into a lot of the federal grant programs that are very, very sophisticated approaches to building privacy. There's been a whole effort done to build privilege management capabilities and define those in a theoretical and practical way to make sure that we're defining how to control access and provide and establish privileges. There's a lot more that can be said about that, much more than I have time to get into here. Next slide. So one of the things the big thing that's going on in public safety today is mobile computing and the use of smartphones. The federal government has came up with $7.5 billion to build a national broadband wireless network to serve public safety agencies called FirstNet, and it's in place now and being rolled out across the country, which allows first responders to talk to each other in a whole new way and to share video information. It provides new bandwidth for doing so. It's a national network that's going to expand into 5G in the next couple of years. So it's really creating a new way to put all that kind of power in the hands of the public safety agencies. Next slide.
So Paul, there's a couple of questions that have come in. If I just jump in here for a moment here.
Yeah.
And folks who are writing these things, I think that feel free to I know you put the notes in here. Unfortunately, Tony Capizzi had to leave, Judge Capizzi had to leave, but there's a couple of questions around how do you use this data in other ways that are particularly relevant. For instance, Tim is talking about any thoughts about sharing and integrating this data with behavioral health to improve care coordination. So this question of what's the intersection between criminal justice, public safety, and those entities, whether they're health entities or behavioral health entities that could benefit and access this information. So,
yeah, absolutely. And if you let me get to that, I'll do so in a couple of seconds.
Okay.
Give me the next slide. I just wanted to point out here that mobile computing is becoming part of the enterprise computing strategy in public safety. Skip to the next slide. I'm going to get to that point. So just a couple words on standards. Public safety and justice agencies have really embraced XML and XML schemas and are rapidly moving even beyond XML with new ontologies, which we'll talk about. One of the key things that has created a set of standards is the National Information Exchange Model, which is really a repository of data elements that have been harmonized across the multiple component domains of criminal justice, but now beyond that to all the other domains that are part of NIEM. We could talk more about that, but skip to the next slide. So as I mentioned earlier, today's standards, a lot of the data standards are really because of the de facto standards that the FBI has created for its centralized databases. Also, the Department of Transportation does the same thing for crash and accident data. The NIEM is really not a standard, it's a framework. It's based on the ISO 11179 metadata registries framework, which gives it a very strong international flavor. And it really has a whole set of common data elements across disciplines and then coupled with domain-specific data. And all of the data elements in NIEM are reference authoritative sources. For example, this is a very important part, I think, of what we're talking about when we talk about the rest of the components of NIC. Using the authoritative sources, like if you want a standard for how you represent an address, what you do is use the standard developed by the Postal Service. They're the most authoritative source for the way to represent address information. And if you want to talk about the caliber of a weapon, that the FBI has that standard pretty well defined, or the brand of a weapon or whatever. But NIEM goes out and finds these authoritative sources for all the different 1,600 data elements that are referenced in that registries framework. There's another standard that's being used in emergency management, and that's the Common Alerting Protocol, which is really just a messaging protocol for getting short messaging out across to the public as well as across agencies. Next slide. So now I want to get specifically to answer that question about the NIC-related information exchanges. I'm just going to touch on some samples that really are the kinds of ways in which public safety and justice connects to other domains, and the other 5 domains that are part of NIC. We've got one project already that we're trying to work on, law enforcement investigation of child abuse. There's something that happens all over the country and in accordance with state law in many cases. We have first responders, of course, providing patient data to hospitals and care providers and creating a starting point for common care coordination. We've identified a lot of work, and as you heard, IACP is working on this, as well as the work that we did in building the prevention playbook for opioid use disorders. Law enforcement plays a role in collecting the data and sharing that data with the opioid problem across with the healthcare communities, human services communities. Collecting data on overdoses is being done today across many disciplines and many jurisdictions because of the work of law enforcement agencies. One of the biggies that requires a joint work of law enforcement, social services, healthcare, and education is offender reentry management, which is, we have a serious problem in this country of having a recidivism rate that is as high as 80% in some areas of the country. And much more work needs to be done to share data to improve that capacity. Disaster response, public safety agencies have an enormous responsibility to collect data on not only what happens to patients, but what happens to property, and sharing that across the whole with the public. Response to terrorism involves connecting with hospitals and medical communities. The active shooter response, there's a lot of work being done to show how law enforcement, social services, and schools need to interact, identifying school safety threats. These are all what I would, these are kind of, I won't call them use cases, but scenarios of interchanges between public safety and justice and other domains that are part of NIC. I just want to highlight a couple. The next slide. This is one of the biggest priorities now in facing the criminal justice world, is how to reduce recidivism. How do we create that combined collaborative effort between justice, human services, and health services to deal with 46% of the people that are incarcerated have a mental health problem, and most of them have a drug problem. And when they leave that jail or prison and return to the community, they need the combined services from the probation officers or parole officers, from the social services, the health services, to make sure they take their meds, etc., in order to really find a way to make those offender reentry problems work. Another really hot topic that you all are well aware of on the next slide is the whole issue of preventing the active shooter. And this is people are finally realizing that unless the police and social services and schools can start sharing information on children that have a problem, or being bullied, or have a social adjustment problem in some way. Enormous privacy issues, of course, with this. Enormous cultural issues to overcome and sharing information across these. But this is one of the biggest problems facing our country today, is how do we stop this violence from happening? And I'm very convinced that it's going to take a collaborative effort on the part of at least 3, if not more, of the 6 domains in NIC to figure out how to stop this before it happens.
So let me open it up a little bit. There's been a number of comments that have come in here.
Go for it.
I'm curious what people's thoughts, responses are to some of these things as we kind of proceed here. In terms of your own experience in your jurisdictions and your organizations or agencies. If you have questions or some comments you want to contribute at this point, we'll continue with the conversations as well.
This is Adam Pertman. In particular, I would love to hear people's thoughts about what of Paul's content resonates most with you. You know, where are the intersections, where are the differences? You know, as you hear this, do you hear, yeah, we can and should be doing that? That's just, you know, those are the same issues we face, or not. I would love to hear this from other perspectives.
Hey, Paul, this is Elliot. So on the education side, I just finished a huge webinar yesterday around emergency preparedness and management. And I'm sitting here going, oh my gosh, there's a couple slides here I would have loved to have stolen, because we talked about the intersection between what we're trying to do in our districts and schools, and that a lot of the work around preparing for an active shooter or an earthquake or a gas leak, it rests on the shoulders of public safety, and that we need to be doing more to provide real-time information about what we're seeing, and it's that sharing of data. So I'm going, this is wonderful. So you're definitely going to get a call from me offline to talk about some things. Yeah, because I'm in states.
Please do call me. I really do want to talk with you.
Yeah, and states are starting to mandate, and this impacts every one of the areas for NIC, school level threat assessment team, where we're supposed to be proactive at looking at data to look at what might be a threat. And I'm not talking the active shooter necessarily. I'm talking about the kid whose family we find out is having an opioid problem.
Exactly.
What is that? Yeah, so it's this whole thing, and how do we break down some of these silos? So that's my comment.
Yep. Good.
Some other thoughts. Brian, I know you just raised a point about the single identifier, and I'm looking at this saying, boy, there's all the connectivity between these various law enforcement agencies and the touch points with schools, social services, police. This is an issue that the proof of concept and the person matching team has been, really wrestling with a little bit the last number of weeks. I don't know if there was a point that you wanted to elaborate on that.
So, Paul, this is Dave. Quick question for you. You said earlier on that many of these systems are fundamentally COTS solutions or products that are brought online. When you look at that, is there a initiative to try to achieve that interoperability? In other words, people who are developing products targeted in these domains, do they have a reference point to say, here's how we're going to secure the exchange of that data, here's how we're going to check for identity and so forth?
Well, that's a really good question, Dave. If you think of that question of interoperability across the various domains that we're focused on, I think the answer is not very much, because there have been a relatively few jurisdictions in the country. There have been some, but not very many, who have really recognized how important it is to create this interoperability for some of the reasons that I just talked about, between education and healthcare and human services. There is some really great work that's been done by the state of Delaware, who they've have a highly integrated criminal justice system. And just a couple of years ago, they said, you know what, it's time we figured out how to interact with the health and human services beyond our own little domain here. But, criminal justice and public safety have been isolated from the rest of the world culturally, I think, is the only explanation. They've all felt like, well, our data is special and we can't share it with anybody because, we got to control it for criminal justice purposes. And the law and the FBI and others have put all these constraints on sharing that make it hard to do. But it's really not, the technology has emerged in the last maybe 10 years that make it so easy to really do this that technology is no longer the issue. It's purely cultural. And, you know, like this whole issue of schools talking to the police. The schools don't trust the police because they're afraid the police will go out and do an arrest or something, and they don't want the child to be damaged. The police don't trust the teachers because they haven't been cleared to get access to this, quote, sensitive, unquote, data. So those fundamental issues of why should we trust each other have to be dealt with before you can deal with the really easy solutions of technology today.
Gotcha.
Paul, I that's sort of what I was getting at with my earlier question. You know, I think one might consider that mistrust to be either like I don't know, disingenuous or misinformed, or one might consider that mistrust to be potentially grounded in real world experience and a understanding of the potential vectors for harm, lawful and otherwise. And you know, you said, well, when it comes to interoperability, the question, what's the purpose, this or that, and that strikes me as a insufficient answer to the question, because we're talking about potentially integrating different systems that have been designed with different purposes and that can be used for different purposes that might not have been intended by one designer or another. So I think my question goes beyond just the intention of, oh, well, we're intending to make it more efficient, and to the question of trade-offs between efficiency for some actors and effectiveness and other kinds of values, other actors.
Yeah, and we don't have, as a nation, we have not established the kinds of policies that would put an answer to those questions that satisfy the users. I believe that it's possible to do so, but we haven't done it. So that's why these obstacles are still there, in my opinion, because the policies have not been discussed. I'll give you one example of where this has been done. Way back when we were first considering this idea of exchanging criminal history data across the country, there were a lot of people that said, well, you shouldn't do that. You know, you shouldn't do that information sharing. We had privacy advocates taking issue with that. And I think that, to respond to your one specific point, a lot of this is because people are ill-informed and they don't think through what is the purpose. What we did was we brought together all the stakeholders, ACLU and Electronic Frontier Foundation and others, and said, okay, what kind of an architecture will you help us build that satisfies the need of law enforcement to share criminal history information across the country, so that we know if someone has been previously arrested or is wanted or, you know, has been convicted of murder and is out, you know, on a warrant. How can we build a system to help law enforcement do their job at the same time protect privacy? We came up with a solution that says, well, what they really cared about was the FBI shouldn't have the data on everybody. So we said, well, we don't need a centralized system. We need a distributed system. We'll keep the data at the state level, responsive to state law on privacy and security. The FBI can have an index, a pointer to where that data flows, but the FBI doesn't get to have it all. And the ACLU said, that's fine, we'll support that totally. And that's what happened. And that system is still alive today because we set that policy in place, you know, back in 1972. There's all kinds of other issues like that we haven't dealt with. I think I teach a course on this at George Washington University, and we talk a lot about the fact that the privacy principles that were developed in the 50s and on international scale are still very valid today, but they don't reflect the availability of technology, and they need to be modernized. But some of those principles that apply to limiting what data you collect to a purpose that government can legitimately define, and also limiting the secondary use of that data in accordance with an established policy that's acceptable to all the stakeholders is where we need to go to. And we have to figure out answers to these policy questions before we all excited about how the technology can do it. That's my long-winded answer, but
And that was a great one, Paul, because policy is just about people. And I think the trust and communication piece you're bringing up on the education side, I mean, yes, we struggle just within the districts and the schools in what we share across. I mean, it's ridiculous sometimes. And I'm glad you dropped the date, 1972 to 2019, and we're still working on this stuff. So the better we can get at it, couldn't agree more.
Other comments or other folks from different perspectives? I keep thinking about public health and public safety and the interaction between those folks, especially around opioid kinds of concerns. Is how do you build the trust? How do you build the appropriate data sharing? And I come back to the trust part of it, so that those two systems can work more synergistically together. I'm curious about folks who are involved in those areas, how you might have been able to approach them. Anyone out there is thinking about that?
let me just add one thing to this. I really think this problem has to be solved at the operational local level to start with, but it needs to be supported at the national level. It's kind of, that old saying that think globally but act locally.
Right.
You've really got to, it takes the police sitting down with the school districts and agreeing that they have a need to share information on mutual problems, and a way to do so that protects everybody's equities, and figure out how to do that. But the more we can create national guidelines on how to do that and get to agreements on some of the common components of doing this, the better those local collaborations will be.
Well, Paul, I'm going to do an editorial here real quick. Last month, the, oh my goodness, REMS, the Regional Emergency Management Support System for Schools, released a handbook, finally, 2019, on the role that districts and schools should play in setting up emergency management plans. And it actually gives the steps that we should be doing in our schools and districts to reach out to the police, what the conversation should consist of. So the stuff is just now we've been doing it, but finally something came from the Department of Education saying this is the best practice and all the steps. Because in education, we need a checklist to make sure we didn't leave something behind. So, and nobody has seen any advertisements about it. I did the webinar yesterday, and nobody on the webinar knew that this document was out there. So I'm going, okay, there's that little bit of a glitch in communication to push a phenomenal course out to 17,000 educational institutions just in K-12. So
that's great.
Any other examples or questions around that? The specific sort of data sharing between whether or not it's education and public safety. I know there's been a little discussion online with public health here.
Eric, what were you saying about public health? I didn't catch I can't see the chat entry.
Yeah. Washington State Department of Health, and we have collect a lot of surveillance data on all sorts of diseases and health conditions, and we need to interoperate with within our organizations and with schools and social services. Just an example, I'm the enterprise data architect, so I'm a single role within an organization of 1,800 people responsible for the data. And even within my organization, I cannot get access to public health data sets to do data analysis because they're stuck in data silos because of data sharing policies. I can't even correlate mental health with TB, with firearms. I can't even do the health portion, let alone connect with external agencies. So the changes in laws are needed.
if I could editorialize just a bit, I think that's one of the kinds of things that, those specific experiences, which I'm sure are universal across the country in many areas, are specific kinds of questions that we're hoping to be able to address, or at least be able to point some attention and light to be able to, reflect those challenges and look for places that are actually effectively doing that, or effectively sharing that information, to be able to highlight those, so to speak, the bright spots out there, so that others can point at that. I look at San Diego and LA and some of the progress that they've made in data sharing the last couple of years, and that's powerful to be able to point at that and suggest that there are some successes that are happening. And again, I think that's one of the goals of this work here is to in fact share that and to identify those places where some of that work is happening, because inside your own state or county, it's very difficult to convince people or to move people along. Maybe having those examples would show the potential of it.
Yes, I agree.
So, Karen, if you want to say a few words about it, because from the public health perspective, and then we can move along. We're getting close to the end here, but I'd love your perspective. I know we've talked about this in the past a little bit, and how do we, in fact, accomplish that, or what are some of the couple of steps that are really necessary in terms of law enforcement and public health?
So, and just to speak to the internal data silos in public health, a lot of that's a fact of history. It's based on either people developing their own legacy systems or legacy systems that the federal government required. And in order to become truly interoperable, you have to actually create a system where those systems can talk to each other, but without sharing identifiable information, and i.e. having a master client index type thing. And that's work that's been going on at the California Department of Public Health in their ecosystem of data sharing, over 25 different disease registries.
Are you all still there?
Yep.
And then, yeah, I think that there are different approaches. The places within, I'm really only familiar with California, but there are a couple of places in California where they've been successful sharing data, particularly around opioids, with law enforcement. And they tend to be fairly small communities where there's a lot of personal relationship. And so some of it, I think, is and also fewer law enforcement agencies. And I think that those two factors have led to some good models that might over time be worth looking at. As far as the technology solutions, that I really am not familiar with.
Thanks, Karen. Yeah, I think that's a great lesson. We'd love to sort of dive into those places that are doing it, and if it's building the trust foundation. Obviously easier to do on a smaller basis than it is on a massive scale. Yeah, one more question, Dan. You're raising your hand over here. You may have to unmute yourself if you're on mute. No, you're good. Dan, Mr. Chavez. Okay, having a little technical challenges here. Okay, great. So, Paul, I think this is the last slide, and then I'd like to turn over to Dave Walsh for a quick round, sort of quick follow-up on the POC and stuff like that.
Yeah, I just wanted to close with this point that everything is a balance, and we have to figure out how to develop the kinds of policies that will restore the trust in government and achieve that interoperability with the significant improvements in our ability to set data standards. But all of that needs to be balanced by much improved governance processes across the domains as well as within the domains. And I think this balancing act is where we got to move to, and that's my story, and I'm sticking with it.
Great slide.
Thank you, Paul. So, Dave, are you on with us here? Mr. Walsh. Let's see if you're here still. You may have had to drop off. I'm not seeing him online here. Maybe he dropped or had to drop off. So if you're on and you can join us, that's fine. I'll just say a few comments around on what's next and what we're up to. So there is for many of you who have been participating, there is now a proof of concept that is underway with a number of members of the organization of members who of the NIC and the Let's Get Technical who have stepped forward to want to participate in actually demonstrating something very tangible around information sharing. And so that is really getting started. It kind of grew out of the person matching conversations we were having earlier on how you do that not only within a system but across systems. The interest now in being able to expand that to look at how do you match people, but also how do you share information once you've been able to accomplish that. And I encourage you, there will be more information online on the Let's Get Technical site as well as the project site. So when you go onto the NIC Hub, you'll see projects, and you can go on there and find out more what's happening with that group. And so we are looking for other people who are interested in participating, and a number of folks have stepped forward, either to participate and or to share information about what they are doing or ways that information is being shared that may be useful. And so we've been having some conversations with different organizations who are actually leading in this area. Some of them you can see on screen here now. We just had a conversation yesterday with the Sensing group, folks from the Michigan Health Information Network, and of course San Diego, and our colleagues with the CIE there have been doing a lot of really interesting work around matching and identification. We're hoping to be able to bring that together along with ChoiceMaker and really sort of demonstrate how this can actually work. So so people can actually point at it and actually be able to actually use the proof of concept in their own states and or be able to build off of those as we go forward. So I encourage you to stay tuned to that, raise your hand, send a note. You can contact Dave Walsh on that. Also, Deep and Rita, who are on that team, and let us know if you're interested in participating in that. There's a couple of follow-ups that we're working on here, and you'll see again online the upcoming reports and processes. So just a couple of quick upcoming events that are going to be happening over the next couple of weeks. We have 2 presentations and discussions. One about the Gravity Project. Many of you may be familiar with that, but in our last conversations, we've really wanted to highlight some of the good work that's going on that is really about identifying social determinant questions. How do those then get coded and brought into a system so that information can be shared and be coded and be standardized. And Evelyn Gallego will be presenting next week on that, and there will be also providing opportunities for having more conversation around what they're doing in Gravity. It started with a really small focus, trying to get some stuff done, and we'll be looking at expanding that, which will be great because that's really cross-cutting in many ways. Following week after that, Dr. Dave Ross from the Public Health Informatics Institute will be talking some about sort of the work that and the experience he's had with interoperability and data sharing actually outside of the U.S. I got to know Dave a number of years ago on a road show that the Robert Wood Johnson Foundation put together, which was called Data for Health, which was in a sense prior to their the Culture of Health program, their main focus for the foundation. And Dave has been in this field for a long time. And when we were speaking recently, he expressed some insights and some interesting observations about the successes of collaboration and data sharing and system change outside of the U.S. that has obviously many fewer resources. And so I encourage you to actually to tune into that and learn more about what's going on there, as well as the work that they're doing within the U.S. The Global Task Force is a major initiative funded in large part by the Gates Foundation, and I'm sure Dave will talk a little bit about sort of the really ambitious, broad vision of really trying to address some global health issues and what we might be able to learn from forward. We'll be adding additional presentations and discussions. We just learned just yesterday from Ann Flagg from the American Public Human Services Association. Will be presenting some on the Family First legislation in the middle of November. And again, that brings us back into the human services and social services field, which should also be interesting. And we'll be posting these as we go forward over time. So I hope to see you online joining us. And of course, as you have questions or thoughts or comments, or if you want to publish some things, by all means, the hub is the right place to go for that. There's been a lot of interaction on that group as well as some of the other groups. So stay tuned to there and add your comments. There's a number of really interesting conversations that are, in fact, on the way there. And obviously, if you're not a member now already, please go ahead and join. And we have, as I said, we'll be posting this conversation as well as notes from the conversation and some of the follow-up action items. So with that, I would just, we have just 2 minutes left. I want to open the floor for any other comments or suggestions or news that people want to share very briefly.
Hey, Daniel, this is Dave Walsh. I'm sorry I got knocked off the internet. Just wanted to say very briefly that we are working on a proof of concept implementation, and one of the things that we're doing right now is developing the user story. It's a advancement of last year's user story, which had to do with somebody who got in trouble with the law. There was a whole case management team and so forth. So would love to have people's input. The goal of the proof of concept is, in fact, to implement some of these solutions. Probably the first one that we're doing is cross-domain name matching. So love to have people participate, especially in helping us evolve the story that we're going to be telling, which requires the exchange of information between various entities and agencies and so forth.
Yeah, thanks, Dave. Maybe one of the things we'll do is when we post that story, we can post it in the context of a threaded conversation. So people will be able to access and then sort of comment on it within that threaded conversation, unless there's a better way, unless someone on the call here has a better suggestion for doing that. But that would be a great way for you to add your comments to it and also see other people's comments about whether or not that user story is actually reflective or as dynamic and